Over 130,000 people reported to be HIV positive, but not on treatment in Mpumalanga. At least 13,000 have been traced and found, and they are back on treatment. Health MEC Sasekani Manzini launched the HIV Treatment Campaign to find those that are not yet on treatment.
People don't take it serious. Once they take medication and they feel better, they don't continue taking treatment. And those who have tested and they don't feel any pain, they feel they're fine. They don't even go and take treatment. So that is the main challenge. Where our people, once you get treatment for 2 months and you feel you are fine, you leave treatment. Or when you don't feel sick, something that we are preaching, that if you don't feel any pain, it does not mean that you are not sick. So that is the problem. And most of these are male people that don't want to take medication. Hence we are saying the campaign must be led by the men, must be led by every sector that we believe are closer to male.
One of the people living with HIV and AIDS highlighted the importance of testing and taking treatment early.
It's important that we provide treatment literacy to everyone that is living with HIV and ensure that those that are living with HIV knows the impact of not starting ARVs as early as possible, because they might be getting early resistance, drug resistance, before it takes too long for one. So it is because within about 10 years you might find yourself having that drug resistance if you didn't start early. So once you start early, you might be able to start to be on treatment for quite 25 years without having been changed to another regimen.
Civil society group organization, among others, made commitment to support the country's efforts to reach the target.
Also trying to reach those who are lost on treatment. Like they've tested, they're positive, and then they've decided to stop their medication with other reasons, and then some maybe they were tested and never initiated or like given the medication. So in our intervention, we're trying to get those people to come back to our facilities so they can get their treatment. Because when you're looking at the numbers, here in eHlanzeni, in the province, we're the highest, and it's so scary that like a lot of young people are on those numbers.
We know that men are not really concerned about their health. It's becoming one of those issues where it's a last object to them to look into when it comes to their health. So today, as men, we have launched a campaign that is called Better Men for Tomorrow, to say we need to change the narrative now. We need to ensure that we engage men, not only just men, boys as well, which are included.
South Africa intends to put additional 1.1 million people living with HIV on life-saving treatment by the end of this year. Mpumalanga Aids Council, SABC News, Mbombela.